Hello, this is Dr. Siddharth Roy. Welcome back to my channel. Today I am here to talk about COVID-19 or coronavirus. We'll be also talking about the history of coronavirus as well as few interesting facts that are related with coronavirus and also the vaccination that is associated with COVID-19 disease. So let us start with the history. The coronavirus was first known to us in the late 1920s. However, the most recent ancestor of coronavirus have been existing among us as recent as 8000 BCE. The first human coronavirus was known to us in 1960 via various experiments done in the United States and United Kingdom. The most common origin of human coronavirus is bats. So now let's start with few facts that are associated with COVID-19 or coronavirus disease. COVID-19 is caused by a virus and not by a bacteria. Coronavirus comes from the family of Coronavidae. Antibiotics does not work upon virus. Patients who are suffering from COVID-19 might develop bacterial infection as a part of complication which can be taken care with the help of antibiotics. Thermal scanners are good in scanning high rise of temperature, but they do not tell us whether the patient is suffering from COVID-19 or not. Peppers. Adding hot peppers to your meals or soup does not prevent you from having COVID-19 and is not a cure for COVID-19. The surgical mask or medical mask worn properly for prolonged hours will not cause any kind of carbon dioxide intoxication or oxygen insufficiency. Most of the people who are suffering from COVID-19 will recover by themselves or with the help of supportive care. So now let's talk about vaccines. Are there vaccines for COVID-19? Yes, scientists across the world have developed many potential vaccines, which includes protein-based vaccine, which uses a form of harmless fragments of proteins or protein shells that mimics the COVID-19 virus and is capable enough to generate an immune response. Viral vector vaccines, which uses a form of safe virus that acts as a platform to produce coronavirus protein and thereby generating an immune response. Weakened or inactivated viral vaccine, which uses a form of inactivated or weakened virus which is harmless but is capable enough to generate an immune response. Lastly, the cutting-edge RNA and DNA based vaccine, which uses a form of genetically engineered RNA or DNA which produces a protein by itself safely and generates an immune response. So now let's talk about the benefits of getting vaccinated. The COVID-19 vaccine provides protection against the disease by creating an immune response against the SARS-CoV-2 virus. If you yourself are getting vaccinated, you might help people around you, because if you yourself are not infected or diseased, you might not infect others as well. So now let's talk who should get vaccinated. COVID-19 vaccine are safe for most of the people around 18 years of age or older, which also includes people who are suffering from predisposing medical conditions such as cardiovascular diseases, hypertension, pulmonary diseases, kidney diseases, and chronic infectious diseases which are controlled and are stable. So the next important question is, can we stop taking the precautions after getting vaccinated? COVID-19 vaccine will provide us protection against severe illness and death, although up to which extent it will protect us from getting the infection and passing it on to others is still unknown. So Don't forget to practice and maintain social distancing, wash your hands regularly, and yes, most importantly, mask up. Don't forget to like and subscribe to our YouTube channel. Do visit our website and like us on Facebook and Instagram.